Hi guys! For those who are new here, this is Surge On, and in here we talk about everything surgical. And this is another Marites file dahil hindi nauubusan ng sakit ang mga paborito nyong celebrities. For this episode, itatakil natin lahat ng sakit ni Kris Aquino, with emphasis sa latest diseases na pinagdadaanan ni Kris. So this woman needs no introduction. Kris Aquino is Kris Aquino, but since importante ang history taking, sadahan natin with emphasis sa familiar or hereditary diseases ng pamilya ni Kris. Si Kris Aquino o Christina Bernadette Coangco Aquino ay isang 53-year-old media personality. Anak siya ng dating Pangulong Cory Aquino na namatay sa edad na 76 noong 2009 dahil sa cardiac arrest. Dahil na rin sa komplikasyon ng sakit niyang colon cancer. Ang ama nitong si Senator Ninoy Aquino ay napaslang sa gunshot wound sa ulo noong 1983 pero diagnosed years prior with progressive coronary insufficiency while he was a political prisoner. Noong 1980, pinalipad ng Amerika si Ninoy para mag-undergo ng triple bypass surgery sa Dallas, Texas. Nanatili siya doon for 3 years until 1983 kung saan siya pinaslang in what is now Ninoy Aquino International Airport. Ang kuya naman niya na si Pinoy ay namatay dahil sa kidney complications and diabetes pero meron din siyang heart complications on top of kidney failure. Okay, so let's talk about the timeline of Kris's illnesses. 2018 nang madiagnose si Kris ng autoimmune thyroiditis and chronic spontaneous urticaria. Lumipad siya ng Amerika para doon magpagamot. 2022 nang madiagnose siya ng Church-Strauss disease or EPGA. More recently, na-diagnose siya ng CREST syndrome or diffuse scleroderma. September ng nakarang taon, Kris also showed signs of SLE or systemic lupus erythematosus. So until now, patuloy pa rin ang gamutan ni Kris. Dahil aside sa mostly novel diseases ang mga ito, meaning bagong mga sakit na wala pa rin mga gamot, allergic din si Kris sa maraming bagay. So basically, mahirap gamutin. Kumustahin natin ang lagay ni Kris sa ngayon?
Dito tayo mag-umpisa.
Yes.
Ano ang kwento, Chrissy?
Okay, kasi nung 3 weeks ago, I had my regular blood panel. So what was alarming was that sobrang bumagsak yung hemoglobin ko. That's part of our yung CBC panel.
So ang chief complaint ni Miss Kris ngayon is anemia. Kulang siya ng hemoglobin, which is the oxygen-carrying component ng red blood cells mo sa dugo.
I fell to below 9. It was the first time na nag-8.7 ako. In other words, kung nasa Pilipinas ako, binibigyan na sana ako ng blood transfusion.
So normal level of hemoglobin is 12 up. Pag 8.5, moderate anemia na yan. Kailangan mo ng salina ng at least 3 bags ng dugo. At least.
Meron akong pang-5 na autoimmune condition na nag-hello ngayon.
Kris has 5 autoimmune diseases. Auto is self, immune is resistensya or allergic response. Ang resistensya mo is beneficial to a certain degree. Yan ang umaatake sa mikrobyo na pumapasok sa katawan. Pero pag sariling katawan mo nang inaatake, masama na ito.
If you'll allow me, pangangalanan natin, I'll start with 2018, na-diagnose ako with autoimmune thyroiditis and yung chronic spontaneous urticaria. Minsan papasok ako na punong-puno ng pantal yung buong katawan and meron akong mga, after that, malalaking mga pasa. It was in April of 2022 na lumala and na-diagnose yung Church-Strauss. Yun ngayon yung pinaka-kontrabida sa buhay ko.
Itong Church-Strauss, okay.
Yes, another name for it, if they will Google, it's EGPA, pero pinadali ko na lang dahil ang hirap i-memorize ng buong EGPA what it stands for.
So let's focus on Kris' third disease. She is a diagnosed case of Church-Strauss syndrome noong 2022. It is named after Jacob Church and Lot Strauss, na unang naglathala nito noong 1951 at tinawag nilang allergic granulomatosis. Pag sinabing syndrome, collection ito ng iba't ibang sintomas na specific to a certain disease. Sa Church-Strauss, may 6 sintomas ka na dapat makita. Basically, mga sintomas ng severe allergic response. Basahin nyo na lang kasi masisira ang buhay nyo. Pag wala ka ng isang sintomas dyan, hindi ka diagnosed as Church-Strauss. Church-Strauss has a new name called EGPA, eosinophilic granulomatosis with polyangiitis. Same disease, new name. Okay, so rundown tayo.
And he was so worried because when you have Church-Strauss, yung blood vessels natin, yun yung tinatamaan. They become inflamed, so nahihirapan yung dugo na dumaloy sa katawan mo.
Inaatake ng katawan ang maraming blood vessels mo, kaya namamaga. That's polyangiitis. Ang eosinophils mo, isang uri ng white blood cells responsible for allergic response, ay dumadami at magre-react sa blood vessels mo at nagkakaroon ng bukol-bukol or granuloma. Pag maraming granuloma, tawag dyan granulomatosis.
Ang problema, boy, is that it was diagnosed nung nasa phase 3 na ako. And that's the last phase.
Okay, so basically what I mentioned is phase 3. So phase 1 to 3 ang church straws or EGPA. So phase 1 mo, allergic phase. Asthma-like symptoms pa lang for 3 to 9 years. Akala ng iba, simple asthma lang. So steroids lang gamot. Phase 2, eosinophilic phase. Pag pinasibisi ka, ang eosinophils mo ang tumataas, which is normally less than 5%. So, nagsushoot siya up to 60%. So, pabalik-balik yan for many years. Pag di na-detect, nagiging phase 3 like what we mentioned. So, vasculitic phase, inaatake na ng blood vessels mo ang buong katawan. So, pag maraming bukol tapos namamagapan, nababarahan at di makadaloy na maayos yung dugo. So, namamatay ang ibang organs. Prone ka atakihin sa puso dahil nga may bara. Yan, so kidneys mo affected din kasi walang blood supply. So, madali kang magka-kidney failure.
Babalikan ko, hindi natin nabanggit na nung nasa Houston ako habang hindi pa gumagaling from COVID because I was a long-haul patient. I had it for more than 3.5 weeks with all the symptoms.
So nakarelate ako dito sa long-haul COVID patient. So I am also a long-hauler. So more than 1 month po akong COVID positive. So kinulong po ako for nearly a month. So walang bintana. So COVID is no joke.
Until now, part of Serge-Strauss is that you have this persistent dry cough at nagkaroon ako ng adult onset, meaning ngayon na matanda na ako, ngayon ako nagkaroon ng asthma.
Okay.
And right now na nag-uusap tayo, that's why
Okay.
binigyan ako ni Alvin na Kleenex,
Okay.
nag-sinusitis na ako.
Basically, symptoms of allergy. So asthma, cough, sipon.
Chrissy, itong lahat na nangyayari sa iyong katawan, paano naaapektuhan ang puso?
Yung muscles na yon that are surrounding my heart, magang-maga sila. Yung sa akin, yung pamamaga, hindi lang sa labas ng puso, kundi dun sa middle layer. Ako, boy, maglakad lang ako papunta ng banyo or mag-attempt ako dahil sinusubukan ko talagang magdagdag ng timbang. Biglang pag tinest na ako, because I have a cardiac monitor dito sa bahay, biglang ang heart rate ko, 120.
Chrissy, gaano kadelikado ito?
I could have a stroke at any time.
So long-term effect ng church straws is heart failure. So may classification po ang heart failure. So we call this the NIHA class. So we classify heart failure depending on whether she experiences difficulty of breathing or chest pain on different degrees of physical activity. So mild, moderate, severe. So napapansin nyo naman hinihingil si Kris throughout the entire interview. Ang pagsasalita is less than ordinary physical activity. So pwede talagang may beginning heart failure na siya.
Okay.
Pero babalikan ko, hindi natin nabanggit na nung nasa Houston ako habang hindi pa gumagaling from COVID, I got a 4th diagnosis. Meron ako ng CREST syndrome. It's the other word for that or the other term is diffuse scleroderma. Yung muscles na yon that are surrounding my heart, magang-maga sila. Yung sa akin, yung pamamaga, hindi lang sa labas ng puso, kundi dun sa middle layer. Ako, boy, maglakad lang ako papunta ng banyo or mag-attempt ako dahil sinusubukan ko talagang magdagdag ng timbang. Biglang pag tinest na ako, because I have a cardiac monitor dito sa bahay, biglang ang heart rate ko, 120.
Chrissy, gaano kadelikado ito?
I could have a stroke at any time.
Yan, so ang daming sakit ni Kris. So balik ulit tayo sa break it down. Let's break it down again. Yan, so Kris is also diagnosed with CREST syndrome. So CREST is an acronym. Calcinosis, nagde-deposit ang calcium sa balat. Raynaud's phenomenon, nagsaspasm ang blood vessels ng kamay pag nalalamigan. Esophageal dysmotility, di gumagalaw na maayos ang iyong
Esophagus.
sclerodactyly, tumitigas ang balat sa mga daliri sa kamay. Telangiectasia. Telangi is small blood vessels sa ilalim ng balat. Ectasia is dilated, meaning maraming ugat-ugat sa ilalim ng balat. Syndrome, alam niyo ng meaning niyan. Pag may kulang sa 5 yan, hindi yan CREST. Pag walang esophagus dyan, curse lang yan. So dapat,
Hindi mawawala ang iyong esophagus.
SLE is systemic lupus erythematosus. So i-reserve natin yan for Selena Gomez. Anyways, hindi pa naman diagnosed case of SLE si Kris.
Nakakatakot yun, boy, kasi ang inaatake naman nun, yung ating lungs. You can get pulmonary hypertension.
Kung sa church straws apektado ang puso, lungs naman ang sa crest. Ang nangyayari sa scleroderma, nagkakaroon ng paninigas ng mga tissues mo sa katawan. Although nawawala ang wrinkles mo kasi nababanat ang balat sa mukha, may side effects din. Usually sa mga areas na kailangan mo rin ng mga loose tissues para gumalaw. Yan, so sa balat, naninigas ang kamay at paa. Mahirap maglakad. Sa baga mo, naninigas yung palibot. So nahihirapan kang huminga dahil nako-compress at tumataas ang pressure mo sa loob. So that is pulmonary hypertension.
It's my right lung, boy, na nung gumawa kami ng buong chest and up to the stomach na CT scan, nakita nila na meron na akong maliliit na nodules at tama, meron mga, parang kung ito yung lungs ko, parang may mga scratch marks kang makikita, parang may mga sugat na.
Yan, so CT scan. So na-mention na ni Kris kung ano yung makikita sa lungs niya. So nagiging peklat kasi nga tumitigas yung lining ng baga mo, hindi na nag-expand. So makikita mo rin sa scan na namamaga yung puso. So dahil inaatake ito ng church straws. Yeah, so walang exact cause ang church straws, so inaalam pa hanggang ngayon. Pero may factor ang genetics at environment sa pagdevelop nito. So usually may constant history ng asthma nung bata pa. So ang crest naman wala ding established cause. Pero usually may exposure din sa allergens. So usually may history ng ibang autoimmune diseases ang tinatama ng church straws at crest syndrome. So gaya ng autoimmune thyroiditis at lupus. Parang nagiging buy one take four yung nangyayari.
I have to relate this because of genetics. Ang lolo ko sa side ng dad ko, he was 55 years old when he had a massive heart attack and cardiac arrest. The reason nakapunta kami sa Boston dati, my dad had his heart attack
At 47.
at 47 years old, and not many people know, but before Noy died, he needed an angioplasty. That was exactly 5 weeks bago siya namatay. So, sa side ng dad ko, matindi yung sakit ng pagkakaroon ng cardiovascular
So
diseases.
genetics dito, Chrissy, medyo plays a role.
So, ang point ni Kris is, regardless of the disease, prone ang pamilya niya to heart complications. And church straws primarily affects the heart. So, she really is in a serious condition. So, we know Kris' personality as somewhat dramatic. Pero itong sakit na ito na meron siya, this is really serious. So, hindi mo matatakpan ang hingal ni Kris. Kitang-kita mo.
Right now, meron akong chemotherapy, which is an immunosuppressant, that's methotrexate. And then I am also taking Dupixent. Isang problema yan because that is not readily available sa Pilipinas.
Yeah, so methotrexate is an antimetabolite. Binibigay ito sa mga patients with autoimmune diseases, aside sa yung mga may cancer, para bumaba yung immune response. So, side effect niya, hihina ang immune response. Madali kang kapitan ng sakit.
Bumalik ako, boy, dun sa inumpisahan sa Houston. That's Nucala, Nucala. That's the
right.
brand. Yung Nucala is available in Singapore, pero wala pa siyang FDA na kahit man lang nag-apply, wala sila sa Pilipinas.
Okay.
So right now, 2 of the 3 medicines I'm on, hindi available sa Pilipinas.
Nucala. So, generic name, mepolizumab. Meaning ng mab, guys, monoclonal antibody. Inaatake nito ang immunoglobulin E mo sa katawan, which is partially responsible for increasing your immune response. Pag bumaba yan, bababa din ang bahagya ang allergic response mo sa katawan. So basically, marami ang causes ng autoimmune diseases. So mahirap timplahin kung ano-anong gamot ang ibibigay sa pasyente. So kasi nga, pag nasobrahan ka ng gamot, side effect, hihina ang resistensya mo.
The next 6 months are crucial. Ano ang mangyayari sa susunod na 6 na buwan?
May susubukan kaming biological na gamot. This is my chance to save my heart. Because kung hindi ito tumalaboy, I stand a very strong chance of having cardiac arrest. But there's a very big risk involved with that medicine because hindi binibigay ang gamot na to, na hindi ka binibigyan muna ng steroids. You need it para hindi ka magkaroon ng
Okay.
anaphylactic shock.
Yeah, so biological drug is any drug extracted from a biological source. So, pwedeng mula sa ibang tao, sa ibang hayop, sa plant, sa bacteria. So, hindi minention ni Kris kung anong biological drug ito.
Dr. John Belperio, who is a physician in UCLA, and he actually does very complicated surgeries. Gumagawa siya ng mga lung transplant because may tama na yung lung ko from my autoimmune illness na Serge-Strauss. That was because may comorbidity na ako, tapos tinamaan ako ng COVID while in Houston when we first arrived here. Siya baling lead physician ko together with a rheumatologist, si Dr. Khan. They're both from UCLA.
Yeah, so Kris doctor is a transplant surgeon. So basically, ang end result kung hindi maagapan yung sakit ni Kris is heart failure for Serge-Strauss and lung failure for Kres syndrome. Yeah, so maraming opera to assist the heart. The worst case scenario is a heart transplant. For lung failure, also the worst case scenario is lung transplant. Lung transplant could be double or single lung transplant. In case of a double lung transplant, ihuhook sa heart lang machine ng pasyente during operation. Ang hiwa sa pasyente kung double lung transplant is pahalang. Tinatawag din namin itong clamshell incision dahil mukhang clam. Pwede rin namang sa gilid kung single lung transplant. Isa-isang ikakabit ang bagong lungs. Iko-connect ang bronchus mo o daanan ng hangin. Pagkatapos ang blood vessels mo, ang pulmonary arteries at ang pulmonary veins. After mag-connect, maglalagay ng mga drains sa palibot para hindi mag-pool sa loob ang namuong dugo, para di ka mahirapang huminga. At isa-isang isasarado ang mga ribs mo, muscles, at last ang balat. Syempre, it's more complicated than that, pero basically, that's the simplified version. That is the Instagram version of our surgical reality. Yeah, so takeaway message. Health is wealth. So kahit bilyonaryo ka pa, health is still the ultimate blessing. So Steve Jobs had pancreatic cancer. We have neurosurgeons dying of cancer. So anyone can be affected by anything. Some people would say, ay, Serge-Strauss, pangmayaman lang yan. Hindi kami makakasakit niyan. So guys, mauna pa tayong mamatay kaysa magka-Serge-Strauss dahil sa mahal ng diagnostic exams niya. So nagkataon lang na may pera si Kris kaya she has the privilege of knowing her full diagnosis, as well as providing for treatment abroad. So ang point ko is, be thankful. We can contract a random disease anytime, whether we like it or not. The fact na healthy tayo is already a blessing. So that's it for today's episode of Marites File. See you again next week for another meaty surgical chisem. Till next time, surge on guys!